Can diabetes truly be reversed? This is a question many people in the United States and across the globe grapple with every single day. Everyone's telling you it's a lifelong condition, but what if there's a different truth about managing your blood sugar that doctors often miss? We are going to cut through the noise and look at 7 critical strategies that can lead to significant changes, potentially putting type 2 diabetes into remission. 1-to-1 achieve significant weight loss. Losing a substantial amount of weight is often the cornerstone of diabetes remission for individuals with type 2 diabetes. The science behind this is clear. Excess fat, particularly around the abdomen and within organs like the liver and pancreas, contributes significantly to insulin resistance. When fat accumulates in these areas, it interferes with the body's ability to produce and utilize insulin effectively. The liver, for example, can become fatty, leading to increased glucose production, while the pancreas's beta cells, responsible for insulin production, can become stressed and less efficient. Studies have consistently shown that even a modest weight reduction, such as losing 5 to 7% of your body weight, can dramatically improve insulin sensitivity. For instance, research indicates that losing just 7% of body weight can reduce the onset of type 2 diabetes by 58%. This weight loss helps to reduce the fat burden on vital organs, allowing them to function more optimally. When insulin sensitivity improves, your cells can take up glucose from the bloodstream more efficiently, leading to lower blood sugar levels. This is not just about looking better, it's about fundamentally altering your body's metabolic landscape. The goal is to achieve what is often referred to as a metabolically healthy weight, where your body's systems can regulate blood sugar without external medication. This doesn't necessarily mean reaching an ideal body mass index. For many, it means finding the weight at which their diabetes goes into remission. Losing weight also has a cascade of other positive effects, reducing inflammation, improving cholesterol levels, and lowering blood pressure, all of which are crucial for overall cardiovascular health, a common concern for people living with diabetes. It's important to remember that this weight loss needs to be sustained over time to maintain remission. This sustained effort is where many find the greatest challenge, but also the greatest reward. Beyond the initial push, creating habits that support long-term weight management, such as regular meal planning and incorporating enjoyable physical activities, becomes paramount. Many people find success by focusing on nutrient-dense foods that promote fullness and satisfaction without excessive calories, like high-fiber vegetables and lean proteins. It's about a lifestyle evolution, not just a temporary diet. The long-term implications of maintaining this healthier weight extend far beyond blood sugar control, impacting joint health, energy levels, and even mental well-being, providing a holistic improvement in quality of life. 2. Adopt a very low-calorie diet. Beyond just general weight loss, specific dietary interventions, particularly very low-calorie diets, have shown remarkable success in inducing type 2 diabetes remission. These diets typically involve consuming between 800 and 1,000 calories per day, often through specially formulated meal replacement shakes or a strictly controlled whole food plan for a set period, usually 8 to 20 weeks. The immediate and profound caloric restriction triggers a rapid reduction in liver fat. Research from studies such as the Diabetes Remission Clinical Trial, or DIRECT, conducted in the United Kingdom, demonstrated that nearly 1/2 of participants who followed a very low-calorie diet achieved remission of their type 2 diabetes after 1 year. This remission was strongly linked to significant weight loss and, critically, the reduction of fat in the pancreas. The theory is that this pancreatic fat interferes with the beta cell's ability to produce insulin. By rapidly reducing this fat, the beta cells can recover their function and begin producing insulin more effectively, in some cases, restoring it to near normal levels. This approach essentially resets the metabolism for many individuals. It is a highly intensive intervention and must be supervised by a healthcare professional due to the potential for nutrient deficiencies and other side effects. However, for those who are able to adhere to it, the results can be truly transformative, offering a powerful pathway towards reducing or eliminating the need for diabetes medication. This isn't just about cutting calories. It's about strategically retraining your body's energy pathways. The rapid weight loss associated with these diets also leads to quick improvements in insulin sensitivity, often seen within days or weeks, making it a highly motivating factor for participants. The structured nature of these diets, often involving liquid meal replacements, removes much of the decision-making around food, which can simplify adherence initially. However, the transition back to a whole food diet requires careful planning and support to prevent weight regain and maintain remission. This post-diet phase is critical for long-term success, emphasizing sustainable eating patterns rather than a return to old habits. 3. Prioritize regular physical activity. While dietary changes often take center stage in diabetes reversal discussions, consistent physical activity plays an indispensable supporting role. Exercise does not directly reverse diabetes in the same way rapid weight loss might, but it profoundly impacts insulin sensitivity and overall metabolic health. When you engage in physical activity, your muscles use glucose for energy, directly lowering blood sugar levels. Moreover, regular exercise enhances insulin sensitivity, meaning your cells become more responsive to the insulin your body produces. This improved responsiveness allows glucose to enter cells more efficiently, reducing the amount that remains in your bloodstream. This is particularly important because insulin resistance is a hallmark of type 2 diabetes. Different types of exercise offer various benefits. Aerobic activities like brisk walking, jogging, swimming, or cycling, when performed for at least 150 minutes per week, improve cardiovascular health and glucose utilization. Strength training, involving activities like lifting weights or bodyweight exercises, builds muscle mass. More muscle mass means more places for glucose to be stored and utilized, further improving blood sugar control. Even short bursts of activity, like walking for a few minutes every half hour, can have a positive impact. For many, integrating 30 minutes of moderate intensity activity most days of the week is a realistic and effective goal. It's not about becoming an athlete, it's about making movement a regular part of your daily routine. Physical activity also helps maintain weight loss, which is critical for sustaining diabetes remission. Furthermore, exercise can help reduce systemic inflammation, a factor that often exacerbates insulin resistance. The benefits extend beyond glucose control, contributing to better cardiovascular health, improved mood, and increased energy levels. Building a sustainable exercise routine often involves finding activities you genuinely enjoy, making it easier to stick with long-term. This might mean joining a walking group, trying a new sport, or simply making a conscious effort to move more throughout the day. Consistency, rather than intensity, is often the most important factor in reaping the long-term benefits of physical activity for diabetes management and potential remission. In just a few moments, I'm going to reveal the single most effective type of dietary change for long-term remission. But first, let's cover another crucial aspect of metabolic health. 4. Control carbohydrate intake strategically. The role of carbohydrates in diabetes management is often misunderstood, but strategic carbohydrate control is a powerful tool for blood sugar regulation and potential diabetes remission. Carbohydrates, once digested, convert into glucose, directly impacting blood sugar levels. For someone with type 2 diabetes or prediabetes, the body struggles to process this glucose efficiently due to insulin resistance or insufficient insulin production. Therefore, reducing the overall carbohydrate load can significantly lessen the burden on the pancreas and improve glucose control. This isn't necessarily about eliminating all carbohydrates, which can be unsustainable and nutritionally restrictive for many. Instead, it involves choosing complex carbohydrates over simple sugars and refined grains, and controlling portion sizes. Complex carbohydrates, found in whole grains, vegetables, and legumes, are digested more slowly, leading to a more gradual rise in blood sugar. Simple carbohydrates, such as those in sugary drinks, white bread, and pastries, cause rapid spikes. Many people find success with lower carbohydrate diets, where the total daily intake of carbohydrates is significantly reduced. This approach can lead to rapid improvements in blood sugar levels, and for some, contribute to weight loss and diabetes remission. The goal is to find a sustainable carbohydrate intake that keeps your blood sugar levels within a healthy range without medication. This requires careful monitoring and often working with a dietitian to ensure nutritional adequacy. The key is understanding how different types of carbohydrates affect your unique physiology and making informed choices. For instance, focusing on non-starchy vegetables as the primary source of carbohydrates, alongside lean proteins and healthy fats, can significantly stabilize blood glucose. Understanding the glycemic index and glycemic load of foods can also be a valuable tool, helping you select carbohydrates that cause less dramatic blood sugar fluctuations. This strategic approach to carbohydrates is about optimizing your body's response, not just restricting entire food groups. It is about empowering you with the knowledge to make informed decisions that directly impact your metabolic health every day. Explore bariatric surgery options. For individuals with severe obesity and type 2 diabetes, bariatric surgery has emerged as a highly effective intervention for inducing diabetes remission, often even before significant weight loss occurs. Procedures such as gastric bypass and sleeve gastrectomy involve altering the digestive system to reduce food intake and absorption. While the primary goal is weight loss, these surgeries also trigger profound metabolic changes that rapidly improve blood sugar control. For example, studies show that 80% or more of patients undergoing gastric bypass experience diabetes remission, with many no longer requiring medication within days or weeks of surgery. This effect is attributed not just to weight loss, but also to changes in gut hormones, such as GLP-1, which enhance insulin secretion and sensitivity. The altered food passage also influences nutrient sensing and absorption, leading to a more favorable metabolic environment. Bariatric surgery is a major medical procedure and is typically considered for individuals with a high body mass index, often over 35, especially if their diabetes is poorly controlled despite other interventions. It is not a first-line treatment for everyone, but for those who qualify, it offers the highest probability of long-term diabetes remission compared to other methods. The decision to pursue bariatric surgery is a complex one, requiring thorough evaluation by a multidisciplinary team. However, the evidence is overwhelming that it is the most potent treatment available for severe obesity and associated type 2 diabetes in the United States and globally. The rapid metabolic improvements seen post-surgery often involve the normalization of blood sugar levels even before substantial weight loss has occurred, highlighting the unique hormonal and physiological shifts induced by these procedures. Patients often report a dramatic reduction or complete elimination of diabetes medications, which can significantly improve their quality of life and reduce the long-term risks associated with diabetes. Post-surgical care is extensive, involving nutritional guidance and lifestyle changes to maintain the benefits and prevent complications. This comprehensive support system is vital for ensuring lasting success and continued remission. Does this feel familiar? You've tried dieting and exercise, but your blood sugar levels still fluctuate. Let's break down why focusing on liver fat is so important. 6. Manage and reduce stress. While often overlooked in the context of physical health, chronic stress plays a significant role in blood sugar dysregulation and can hinder efforts towards diabetes remission. When you experience stress, your body releases hormones like cortisol and adrenaline. These hormones are part of your body's fight or flight response, and they temporarily raise blood sugar levels to provide quick energy. In the short term, this is a survival mechanism. However, if stress is chronic, these elevated stress hormones can lead to persistent high blood sugar, increased insulin resistance, and even weight gain, particularly around the abdomen. This creates a vicious cycle that makes managing diabetes more challenging. Therefore, incorporating stress management techniques into your daily routine is crucial. Practices such as mindfulness meditation, deep breathing exercises, yoga, and spending time in nature can help calm the nervous system and reduce the release of stress hormones. Even simple activities like listening to music, engaging in hobbies, or connecting with loved ones can significantly lower stress levels. For some, seeking professional help from a therapist or counselor to develop coping strategies for chronic stress may be beneficial. It is important to recognize that stress is not just a mental state. It has tangible physiological impacts on your body's ability to regulate blood sugar. By actively managing stress, you create a more favorable internal environment for your body to heal and respond better to other diabetes reversal strategies. The link between stress and blood sugar is profound and often underestimated. When stress levels are consistently high, the body is in a constant state of alert, making it difficult for insulin to do its job efficiently. This can manifest as unexplained blood sugar spikes even when dietary intake is well controlled. Therefore, developing a personalized stress management toolkit is essential for anyone aiming for diabetes remission. This might involve setting boundaries in personal and professional life, practicing gratitude, or engaging in regular physical activity, which also serves as an excellent stress reliever. The cumulative effect of reducing daily stressors can significantly improve overall metabolic flexibility. 7. Optimize sleep quality and duration. Sleep is not merely a period of rest. It is a vital biological process that profoundly impacts metabolic health and, consequently, the potential for diabetes remission. Chronic sleep deprivation or poor sleep quality can significantly impair glucose metabolism and insulin sensitivity. When you don't get enough sleep, typically less than 7 hours per night for adults, your body experiences several detrimental effects. Firstly, it can increase insulin resistance, making your cells less responsive to insulin. This means your pancreas has to work harder to produce more insulin to keep blood sugar levels in check, eventually leading to beta cell exhaustion. Secondly, poor sleep can disrupt appetite-regulating hormones, leading to increased cravings for high-calorie, high-carbohydrate foods, which can contribute to weight gain and higher blood sugar. Thirdly, it can elevate stress hormones like cortisol, further contributing to insulin resistance. Studies have shown that even a few nights of insufficient sleep can lead to prediabetic glucose levels in healthy individuals. Therefore, prioritizing 7 to 9 hours of quality sleep each night is a non-negotiable component of diabetes management and remission efforts. Establishing a consistent sleep schedule, creating a relaxing bedtime routine, ensuring a dark and cool sleep environment, and avoiding caffeine and heavy meals before bed can all contribute to better sleep. If you suspect you have a sleep disorder like sleep apnea, which is common among people with diabetes and can significantly worsen blood sugar control, it is essential to seek medical evaluation and treatment. Improving your sleep is a powerful, often underestimated strategy that supports all other efforts to achieve diabetes remission. The impact of sleep extends to every aspect of metabolic regulation, from insulin sensitivity to hormone balance. For example, growth hormone and melatonin, both crucial for metabolic processes, are primarily released during deep sleep. Disruptions to this natural rhythm can throw the entire system off balance. Addressing sleep issues can sometimes lead to surprisingly rapid improvements in blood sugar control, even before other lifestyle changes fully take effect. This underscores the interconnectedness of various health factors in the journey towards diabetes remission. If you enjoyed this video, you will probably also like this one. Please subscribe to this channel and let us know in the comments your thoughts. Thanks for watching.